So first of all, Trump won, right? So that's good.
Yes, he did, which
Yeah,
means RFK Jr. is now in the White House, which means our healthcare system is going to be reformed.
I just can't wait. Okay, so um, I want to talk about that definitely. Hello, everyone. I'm Coach Ariel, Starbird, holistic health and fitness coach. Today, I have with me once again Shiloh Thompson. She's a holistic naturopath, certified functional medicine practitioner. And we're going to continue the topic we started last week because it's a massive, massive topic how women are lied to and gaslit by the medical system. I'm realizing that although it's possible to talk about just how women are gaslit, we can't help but also bring up how men are gaslit and how children are gaslit. And there's a couple of things I wanted to run by you that just make zero sense. And I want to get your opinion on that. But first, I want to celebrate the fact that Trump won. That's awesome.
Yes.
You were mentioning that RFK Jr. is now going to be in the White House. And you were saying that now the whole medical system is going to change. So let's talk about that. How do you think it's going to change?
Well, our agencies, as you know, have been corrupted. They're very corrupt. And the information that they often spread to the public is wrong information. It's dangerous, such as the COVID vaccines and the COVID restrictions that they were putting out there, such as masking, things like the shot being safe. It was all misinformation that our own government was putting out there. And then they were censoring doctors and scientists and people that were speaking out against it for creating disinformation, right?
That's correct.
So RFK Jr. is actually being put as ahead as he's either going to be in the agency or above the agency or some sort of a health czar, but he is going to be over top of all of our healthcare agencies, starting with Health and Human Services, the FDA, USDA. They've already contacted some of the regenerative farmers and asked them to join the Trump administration just for consulting purposes to bring back the small family farms, regenerative farming practices. All of this is already in play. If you go to Twitter, you can actually follow RFK Jr. in some of these developments. So that's a really good thing. He's already put out there the people's policies. So there's a website that you can go to that you can give your ideas of what type of policies you would like to see. And so anyway, so long story short, we're not sure exactly what role he's going to have. Trump said that he is going to let him go wild. So, so
So
people,
yeah, let me.
the
Oh,
they're
okay.
going to be, these administrations are going to get weaned out. They're going to be much smaller. They're not going to be able to have revolving doors with pharmaceutical companies. So the pharmaceutical ads will no longer be shown on TV dealing drugs to people, everyday people. So there's a lot that's going to happen. And I think it's going to be a hard time. It's going to be a rough road for people. But I think that the reward on the other side is going to be a healthier nation. And Trump literally gave the deadline of 2 years. He wants to see an improvement in children's health in 2 years. So
I
he's got
hope
a lot on his plate.
I hope sooner, but I understand that when you have a big, massive machine, it's hard to make fast steps. So I was doing research on all the problems with vaccines for over 20 years. Even
Mhm.
before I knew all the details about holistic stuff, before I became a holistic coach, I was doing lots of research about all the ways that they're bad. And there were at that time already a lot of doctors and even more like politically oriented people who were 100% against vaccines.
Correct.
And then sometime in the last, especially maybe a little bit before COVID and during, it became very dangerous to have that stance. You were called a radical. You could be arrested. Things could get really bad for you if you just took that stance. Didn't really do anything, just said that you're against. And so a lot of people who previously were 100% against softened their position and were kind of talking around it. And I understood that they did that for self-preservation, but the truth is still the truth. And I
Correct.
am based on my research. Uh, like I said, I've never met a vaccine that was good for you. They all have something not good
They
in
all
them.
have a risk, a high risk, so it's
Yes.
that risk reward. So with doctors, actually, so when Obamacare, um, I don't know if you remember, I remember being so happy about Obamacare. I was so happy because I was going to be able to afford insurance for my kids and myself as a single mom. And not that we even used the doctor, but I was so excited. And then the very next year, the premiums went sky high, and then the insurance looked very different. Like it wasn't like you couldn't just get catastrophic care anymore. There was all these different, like the insurance companies gained so much power. So even if you were a pediatrician or you were a physician, and in your own stance, you decided to give informed consent or to not pressure parents into giving vaccines to their kids or to themselves, right? Elderly are the second most vaccine injured group in the United States, right? So what would happen is the insurance companies get involved. And so your practice receives like these big, huge bonuses. If 70% or 80% of your practice is up to date on vaccines, they receive this astronomical amounts of money for their practice, right? Bonuses, let's just say what they are, and kickbacks. And so what would happen is if most doctors are in a practice, they're in like a Centricare or an Alina clinic, kind of like a full practice with other, with hospitals and things like that. They would see your numbers and they would see that your patients were not up to date. So they're losing millions and millions and millions of dollars every year because of what you're doing. So that way they could deter doctors from being honest and from protecting those patients in their group. And so that's when you started seeing my doctor kicked us out. My doctor won't let my child go to their practice. And that's why, because they're losing so much money. And so the insurance companies actually took over and they have so much power with that. And so like their tracking systems, I remember, so my daughter's vaccine injured, my story with my daughter, and she's fully recovered, little 14-year-old barrel racer, crazy kid, like super, super intelligent and super like anti-vaccine. She doesn't want anything in her body.
Thank
And
God.
yeah. And so she was vaccinated up to the age of like 14 months. And I remember just a couple of years ago, we were living in Minnesota and I got a letter from the state. And the state had this letter saying that my daughter was late, and she didn't have her preventative care measures taken, and she needed to be brought up to date on this whole list of vaccines that she hadn't gotten because she was like 9, 10 years old by that time, and we stopped at 14 months, right? And I got this letter and I'm like, how does the state know what my daughter's vaccine record is? Like, how would they know that information? Well, our doctors now are all electronically connected, and the health insurance companies are all connected, and they're sharing that information. So I was shocked because I thought my medical records were private between me and my doctor, but that's not the case. So I was really shocked. And so that's what Obamacare has brought about. And health insurance is not safe anymore. Like health insurance dictates what a doctor can and cannot do for you. And many times it leaves patients that actually need therapies or need things, it leaves them either fighting, insurance companies paying out of pocket, not being able to afford things, not to mention the cost is outrageous now from, the health insurance. And so I'm really hoping that all of that is like totally reconstructed. I hear a lot of holistic practitioners saying, we want to be part of the insurance plan. And I'm like, no, you don't. We don't want some body governing what we can and can't do for our clients, right? Or our patients, or, depending on what field you're in. And so, people think that it's a good way to generate revenue for your practice, but actually it's a really it's a really just I don't it's just not a good it's just
Yeah,
not a
well,
good way to
they're using mafia tag. That's why they call it the medical mafia. And so I wonder, is it too much to ask to dismantle the entire medical mafia in like a I feel
they
like a
need to.
month or a year? Because it is a medical mafia, in fact. And if we study, I don't know if we have time to go into all the tactics now in this conversation, all the ways in which it's really another a whole hour that we could talk about what exactly are methodologies and tactics that the insurance companies, why are they operating like a mafia, why it's not just a legitimate business, and how the pharmaceutical industry is also a medical mafia, and so as a result people are just getting damaged. Yeah, it's, I mean, all of it ties into gaslighting, but it's the gaslighting of the entire population. And people, yeah, people like you and I, we check out of those kinds of systems because we know they suck and they don't help. And a lot of people know that. They figure out after a while that, wow, my insurance doesn't cover anything that I need. And they just
Correct.
get rid of it. They just get rid of it and they pay for everything out of pocket. But if you have a very serious health issue, you'll lose your entire life savings to whatever you're dealing with. And
Mhm.
it becomes a nightmare, actually.
Right. And now our health insurance agencies are getting tied in with the government. So I don't know if you've seen, but like if you were to go to Minsure or healthcare.gov, which is what they're trying to funnel people into, right? And you were to click and you wanted health insurance, they would say, oh, the premium is $1,000 a month, even if you're a person that never uses a doctor, is $1,000 a month. But the subsidy, the government subsidy is going to pay 700 or $800 of this, and you're only responsible for 200 and something dollars. And then I'm like, well, what happens with this government subsidy? Like, what happens? Who's paying for that? Who's really paying for that? And then at the end of the year, or like most people, they pay taxes when they work, right? I pay taxes, pay an awful lot of taxes, and I pay extra taxes because I do a lot of freelancing as an interpreter. And so at the end of the year, I tend to get back a little bit of money, right? I have a family, so I get back, I'm head of household, get a little money back. And I'm like, would they take that money from a person? Is that what they do at the end of the year? They say, well, you spent this, this, and this, and now you owe us. Like, I'm not really sure because I'm not in that system, but I just know from other people and talking about it, like it just doesn't seem like people think that it's a good idea for the government to get involved and to take care of you and to take care of your health and to pay for these things. But Canada has terrible health care, terrible. And that's all government funded. There's no way to make that a safe system or an effective system. So I just really don't know. I'm really hoping, I'm waiting to see what's going to happen. I know people are already screaming that Trump is going to take away healthcare and, I mean, you hear all the horror stories, but that's not really the case. He is a
No,
smart man.
yeah, I know who is screaming that, and there's people who are always going to be screaming that they've missed the entire story of the last like 12 years of what's going on. They're like, yeah,
Right.
they're not paying attention. I know that's not going to happen. I don't believe that, but at all. But my question is, do you think that with the new system, they're just going to do away with vaccines entirely, or is it going to be an option?
Well, so this is my prediction, right? So RFK has already come out and said, I'm not taking away vaccines from people who want them. I just don't want an untested, unsafe product forced on 80 million people a year. It's just, it's not okay, right? Or on 80 million children, whatever. And 83% of the children in the United States. So he's against mandates and he's against unsafe vaccines. Now, if you've ever followed the high wire with Del Bigtree, um, you know, uh, there's a lot of talk about the safety studies and lack of, right? There's never ever been a double-blind placebo study on a vaccine ever. Okay. They say there has been, but there
Well,
has.
see, that's my next question is, okay, so if they're going to leave an option for people to get vaccines, they're going to have to scrap everything that they've had so far and start totally new studies that are going to produce totally different science. They're going to create totally different vaccines.
So I agree. And I think what's going to happen is my hope for the future is that we're going to go to a homeopathy system, right? Something like a homeoprophylaxis system, and which is cheap, it's effective, it works, it's safe. There's nothing safer than homeoprophylaxis.
By the way, speaking of gaslighting of women, here in New York years ago, when I was researching what are the local possibilities and options for alternatives to vaccines to like get your kid in school and all that. And I heard horror stories where like this one doctor, she was offering homeopathic vaccines at some point that was still kind of possible. So social services went in, took her kid. She lost her medical license. They threw her in prison just because she was offering homeopathic vaccines.
Wow, that's crazy.
Yeah, that's right. No, nobody was harmed by that.
Right.
Actually. But they and I don't remember what the claim was. Oh, medical claims. You're making medical claims. You're something like that. You're making claims that your vaccines perform a medical service.
Right.
Yeah.
So they did something similar to Highlands. Highlands used to have a really good teething homeopathic, right? And it
Yeah.
had belladonna in it. Now, belladonna, the homeopathic version of the belladonna, there's no actual physical belladonna in there. It's completely safe, 100%. You're only getting the energetic form of belladonna. You're not getting the plant, right? Or the physical substance of belladonna. Anyway, so they went back and made Highlands. They put a big lawsuit on them and said that this teething product was possibly, they couldn't declare it, was possibly causing seizures in babies 4 to 6 months old, right? And so like Highlands comes out with a big statement. It says it's impossible for a homeopathic to cause such a reaction. Like this isn't true. This isn't right. Well, Highlands took that off of the market and changed it. They ended up changing. I think there's like a chamomile one now instead of belladonna, which we use belladonna for fevers here all the time. But what I was going to say about that is now they said that this product was causing seizures or potential seizures in 4 to 6 month old babies. What happens at 4 and 6 months?
Vaccines?
Vaccines. So, so the correlation wasn't the homeopathic at all. It was the vaccination schedule. Yeah.
Of course. See, it's so obvious to you and me, but to an average person, it isn't. And another thing that I think happens when people, if they haven't done research before, and then they start to have a crisis, and they're scared, they're so suggestible to any bullshit that comes along.
Correct.
They're especially suggestible to gaslighting from authorities when they're in a crisis. Unless you are a mind over matter, stoic kind of person, and you question everything you're told, people just buy into whatever they're told.
Yeah. One thing I wanted to talk about tonight, if it's okay, is I wanted to bring up mammograms. I know we're past the October deadline. We wanted to do this, series in October for Breast Cancer Awareness Month.
That's okay. Let's talk about it because it's always an important issue.
I think it's one of the biggest lies women are told is you get your annual mammogram. Get your mammogram. Do you know mammography is over 100 years old? Over 100 years old. Like it's so outdated on itself. And so what happens is like they've studied that having a mammogram is actually not only is it gives a lot of false information and shows a lot of false cancers. They call it dense tissue, right? But we'll explain dense tissue in a moment. But so they're treating a lot of cancers that aren't even cancer or that possibly could form a cancer, but typically clear themselves. And the human body has an immune system, and typically we take care of things. Obviously, there's high-risk groups and high-risk people that might have an abundance of inflammation that just kicks on those genes or creates these hormonal cancers. That's what they are. But anyway, so as a female, I don't know, like, well, I don't go to the doctor, but my sister's a nurse, and she's like, I gotta get my mammogram, and I'm don't get a mammogram. That's dangerous. And she said, oh, no, you got to get a mammogram. That's how you screen for breast cancer. Well, there's much safer ways screen for
Let's
breast
explain
cancer.
to people what exactly that is. So, from my understanding, a mammogram is it's like like a flatbed. A female puts her breast into it, then something squishes it. You're
Right.
like it's like squishes it to this thin, and then scans it. But it essentially what that does is it breaks the tissue inside, and the breaking of the tissue inside can actually cause cancer.
Correct. It can
It's,
cause cancer, it can spread cancer, and it fills your body full of radiation that you don't need.
yeah, a breast isn't supposed to be squished to this thin.
Right.
That's
Right.
not a normal condition for a breast. Yeah, yeah.
And so some of these doctors that were going out, they're like, a good thing to tell people instead of just taking my word for it, go on YouTube and just Google why are mammograms unsafe or are mammograms safe? And you'll get
But
two
that's
different groups of
conspiracy
people.
theory. Why would, yeah, people are like, well, what, that's conspiracy? That's just YouTube. I trust my doctor.
Right. Well, these are doctors. So you can go to any doctor and you can look at the doctors and look at the research.
Yes, I
And,
think that's
you
it.
know,
It's a
back
doc.
in 13 and 20 years ago, doctors, real oncologists, real doctors were warning against mammograms for women, routine mammograms. Now, I'm not saying that there might not ever be a time that you might need um, maybe a mammogram. I would prefer an ultrasound or an MRI or something that would show something in that breast.
Well, what
If
about
there's
thermography?
issues,
What about thermography? That's I think
thermography is a fantastic,
completely non-invasive, easy to
correct,
do, way more affordable, and doesn't really have a risk to it at all.
correct.
Yeah,
I'll tell you about thermography. We used to have Lighthouse thermography come into my clinic and do thermography scans for women. And so I got to experience a scan for myself. That was part of like the whole like the payment plan for them coming into my clinic was we're going to give you a scan, full body scan. They're like 500 and something dollars, but for me it was free. And so they wanted me to understand so that I could talk with my clients about what they are seeing, what the report shows, right? So they did the scan on me, and the lady right away was like, what's going on in your face? And I was like, well, nothing that I know of. And she said, yeah, she said, you have something going on here. And I had this major infected tooth that had been like bothering me. And I mean, it was really bothering me. I kept like putting like echinacea golden seal in my cheek and trying to like, I'd get it down and then it would just have these flare ups. Well, I did not realize how dangerous that infection was. Okay. So that infection actually showed in the thermography scan as she's taking the picture. The inflammation from that was going from my face all the way up into my brain, right? And then there was some that was trickling down towards the breast in the lymphatic area. And she said, stop. She said, I'm going to send you to my husband right away. And I said, who's your husband? She said, he's a dentist. You need to go see him. She said, you're in an emergency situation. And she called him and said, I need you to see her. She's on her way right now and take care of her. And I ended up on an antibiotic at that time. It wasn't a horrible one. It was amoxicillin, but at that time he gave me no choice. He said, you are in dire straits. Your
wow.
infection is systematic and it's spreading to your brain and you need to do something immediately. And so I was really thankful for that thermography scan. I really was. And so I was able to take care of it. I dealt with it. He wanted to take my teeth and I said, oh, there's nothing wrong with the tooth. You're not taking my teeth. And so I ended up keeping my teeth, but I did a lot of therapy on them and, I recovered it. I had a lot of bone loss. There was a lot of damage there.
Gotcha.
So just from
So,
ignoring an infection.
yeah, yeah, that's problematic. Well, sometimes people don't know. So I know most people are not going to know what thermography is. So I just pulled up a couple of images, and I
Oh, cool.
and I just want to share. This is just from online. I literally just typed in thermography images,
Mhm.
and this is
Yeah,
basic.
so it's just an infrared thermal camera that
Exactly. So
that
it,
shows. See the white there on number 4 where your cursor is? That's hot. That is really, really hot inflammation. And then the red there is inflammation. And as we get cooler, it's cooler areas of the body. It doesn't show as much inflammation. But you see that red and that white, that was going into my brain.
Yeah. And so this person around his mouth has massive inflammation, right?
It
Yeah.
could be. Yep. Yep.
Mhm. Yeah. So
Um,
and the idea is, so I guess this is just a device, but I remember getting a thermography scan some years ago of the whole
Yeah,
body.
here's the camera down below. If you go down below, there's a big camera. And that so this is thermography as best thermal imaging. There's all different types of cameras. But yes, there is the camera there. And
Yep.
that shows it. And you see the woman's breast there. Now, see if you can look there. I'm not a radiologist, but I can see here, just right here. That's just the warmth from the body, from where the breast kind of lays over
Yeah,
on,
she doesn't have inflammation in her breast, so she doesn't have cancer. So it's like right there.
correct.
Yeah, this is pretty accurate. And
Mhm.
you don't have to squish the breast. There's nothing invasive. You just kind of you have to be in a cold room for like whatever. You have to sit still in a cold room while they scan you. But that's it. It's
Right.
easy.
And the thing about it is it can detect a tumor in the breast 10 years before a mammogram can ever pick that tumor up.
See, that's huge. That's
Again,
pretty huge.
I want to be cautious though about that, because what's happening with women for the most part with these mammograms and this early detection is we're detecting cancers that aren't aren't going to be a problem. They're just a normal little, a little mass or a little bit of a cancer that just clears itself over time. And so when we're doing all this early detection, we're actually treating people for cancer and killing them potentially for cancers that would never have became anything in the body. The body just naturally would have took care of it. And young women, I really want to caution young women against mammograms for sure, because our tissues are so dense. They're so thick. We have so much stuff going on in there. We have like the lobula glands, and we have the milk ducts, and we have fat tissue, and and all of this, we have like estradiol that keeps this all ready for us, right? It makes sure that these glands are healthy and that they're able to produce milk, because that's what they're for, right? And our breasts during childbearing years are very dense tissue. All kinds of stuff happening in that breast, right? We don't want to go and scan it because the doctors say right away, oh, we have dense tissue. I'm concerned. This is a high marker for cancer. No, it's not a high marker for cancer. Not at all. It's the high marker for having plenty of hormone and being of childbearing years, right? After menopause, what happens is our estradiol, our estrogen, we stop producing estrogen. And then those things, those little ducts and those little areas where the milk is made, the lobulas, they start to shrink, and they just kind of dry up. They just shrivel up to nothing. And then our breast tissue is then replaced with fat, right? So um, after the menopausal age, I'm not going to say it's less dangerous to get a mammogram. I'm just saying that they are less likely to want to pre-treat you for cancer because of the fact that you have dense tissue.
It's like they're trying to create a problem rather than solve the problems that are there.
Correct. Yeah.
And I'm sure we can say a lot more about mammograms. And I don't know too much about them because I don't bother with bullshit.
Right.
Yeah,
Well, it is scary, but even if you were to get a thermography scan, like you might get something that has a suspect lump or a bump. My recommendation would be, if you're well and you feel healthy and you're not having any issues, then I would say let's scan again in 3 months. Let's change our diet, see if we can, work on this holistically, and then maybe do a little detoxing, and then we'll see again. Typically, those type of cancers that form, those are really estrogen-based cancers. The estrogens that they say cause a lot of that inflammation is estrogens. So there's lots of estrogens in the body. We have about 10 of them, but estradiol is typically the healthy estrogen, and estrone is typically the one that is more inflammatory. And so, that those are the types of things that I would like to look at rather than let's jump and start like getting rid of the cancer. How about we just make sure that our body's regulating properly and see, so that's one of the biggest lies I think is in healthcare is mammograms. They're not safe, they're not effective, and they cause more problems than what they solve. We just need new technology. Thermography should be the way to go.
Absolutely. Well, and that's so the question is all of these thermography is just one of many holistic technologies. Like something like the Hippocrates Institute has a plethora, a whole giant toolbox of all kinds of technologies that we've already had that are holistic, non-invasive, non-toxic. Why can't either insurance pay for that, or people make enough money that they can just afford to pay for those kinds of
Right,
services? Because most people
right,
can't afford to pay for that. That's very expensive.
right. Well, the way I see it is if you're not paying, a lot of people are paying 5, 6, 7, sometimes up to the thousands for health insurance monthly. Maybe it's time for America to feel like it's time to be self-insured. Maybe we open up our own little HSA and our own savings account and we save money for these types of things, right? And better yet, how about prevention? How about taking these chemicals out of our foods? How about avoiding foods that might be toxic? Obviously, when you live in the city, it's hard to get it's really hard to get true organically grown produce and vegetables under a budget. I totally get it. I get it. But even sticking with a whole food diet is better than the processed foods that we're just doing every day.
Absolutely. So I was again looking online. I just went on YouTube and typed in all the ways women are gaslighted about women's health. And I just want to see what's already
Mhm.
out there. What
Right?
conventional, regular, like today, NBC, MSNBC, what are they saying about it? Well, it turns out they know. I want to
Right.
show you, I don't know if I can show you the whole thing. We don't need to see the whole thing, but maybe let's just watch the first 3 minutes and then we're going to talk about this.
Okay.
It's been called the Me Too of healthcare. Doctors misdiagnosing, dismissing, even gaslighting their female patients.
I heard everything from you're just tired to one doctor actually said, well, I think it's just because you have your period.
I was told that I was overweight. I needed to lose weight, that I was depressed and needed therapy.
For 4 years, Maria Garcia suffered from intense stomach and back pain, but says her doctors told her there was nothing wrong. She just needed to slim down. When her symptoms escalated, vomiting, weakness, and hair loss, she says her specialist still dismissed her.
I begged him for a CAT scan. Please do something. This is not right. Oh, you'll just have to learn to live with it.
Do you feel completely crazy?
I started to believe them. I thought, maybe I am crazy.
Health failing, she finally went to the ER at Cedars-Sinai Hospital in Los Angeles, where a scan revealed the terrifying truth. Maria had a 25-pound cancerous tumor growing in her ovary. Surgeons were able to remove it just in time.
I was probably about 2 weeks away from death.
So did you feel, once you got your diagnosis, rage or relief?
Both. I think being an overweight Hispanic woman was to my detriment. Everything could be attributed to either me being dramatic, exaggerating, and being fat. You've got nurses that were...
Studies showed bias against women, especially those of color, is a problem across healthcare, from treatment to research.
Most of the data that we use today in medicine is based on research on men, male animals, or male cells, which is just
pause a second about that. Repeat that, because much of what we know today when it comes to health is based on men.
Yes.
Experts say the worst medical gaslighting comes in the diagnosis of autoimmune diseases, which impact an estimated 1 in 5 women and involve symptoms easy to write off, like chronic fatigue.
Autoimmune diseases were just about 10 years behind where we should be.
In her new book, The Invisible Kingdom, author Megan O'Rourke documents her own struggle with autoimmune symptoms and her battle to be believed by doctors.
I felt so alone when I was sick, and I distrusted myself.
Women feel such shame with their symptoms. They don't want to seem hysterical, or they don't want to seem like they're a complainer.
Yeah.
What is your hope that this book does?
My primary hope is that it helps people feel heard and seen.
Leaders at the country's top hospitals are also pushing for change, securing more funding for women's health research, training doctors on how to recognize their gender biases, and empowering female patients to advocate for themselves.
Women want to be the good patient, right? They don't want to disappoint their doctor. They don't want to make anyone angry. So I think it's really important for patients to understand that medicine is really a teamwork.
To get the best care, experts say, keep a detailed diary of your symptoms to show doctors. Ask for a thorough physical exam, and don't be afraid to get a second, third, or even fourth opinion. Maria Garcia says that saved her life.
So now I stand up for myself, and I encourage other women to do the same. Stand up. You're worth it.
If you aren't feeling heard by your doctors, experts say another good approach is to ask them, hey, if you were in my position, what questions would you ask? And what specialist would you see next? So it's important to remember that doctors are often patients themselves. So they say appeal to them on that level, on the first.
And I just think the whole thing about research not being done on women for diseases that
That's
are
a
affecting
whole
women
other
is
story.
I was going to pause right there because then they're just talking about what they said. And we don't necessarily need to hear their banter. So there's a few interesting things in here, but I wanted to show you a comment that I thought was very pertinent. This woman said, when you're very ill, it is impossible to stand up for yourself. I'm tired of medical abuse. You know what? She's right. People who are incredibly sick, going through a crisis, they can't also be their own advocates, going to court and defend. Like, you need allies, you need people by your side. And a lot of times in our society, people don't have that. Once you get ill, people don't want to deal with you.
Right.
They are so busy with their own lives. They don't really care that, and a lot of times these problems are so complicated. Maybe for a few months, they're supportive and understanding. But when you have an autoimmune, that it usually takes, because it's misdiagnosed, very often people are in that crisis for years before they finally find a solution. And like an average person doesn't have that kind of patience or that kind of time to be by the bedside of a person who looks like they're dying for several years, and it's, so yeah, it's pretty nightmarish. And it's incredible to me how many people have no idea about how the horrific experience of people once they get unwell, because they themselves have, if they themselves have never been unwell, and because we kind of have a very selfish society, people don't really experience people being unwell. As soon as someone is unwell, they're very quickly taken out of the circulation by the medical system. This is what I know, especially with older people. As soon as they're unwell, they're very quickly given medication, surgeries, and they go downhill so fast, no one has time to even realize what happened to them.
Right.
And no one ever hears their story. And very few will survive that medical ringer, that maelstrom, the quicksand that sucks people into a very dark place in the medical system. So few people come out of that very few stories are ever told. And a lot of times what I've experienced, once they come out of that horror, they don't want to talk about it. They're so exhausted. And they're just so glad to be alive. They just want to be left alone. They're not necessarily advocates. It takes a certain kind of personality to become an advocate for health. And most people just aren't. They just want to be left alone and try to live a normal life. And so as a result, most people are not aware of these problems until it happens to them.
Right.
So they don't gather allies ahead of time for this kind of thing. And unless they had a very strong family to begin with, they end up going through all the stuff alone. And how many people have strong families nowadays? So it's a whole other topic, like the destruction of the family and isolating everybody, making sure they're they easily become victims of this stuff. This is another important point. Do a report on how people with mental illness get mistreated, misdiagnosed, and gaslighted. Yeah, but I also don't necessarily believe that everyone who is diagnosed with mental illness has that.
Right.
Because a lot of women are told it's in your head, whatever it is, and diagnoses are literally made up by various people to cover up what's really going on, and the diagnosis doesn't actually help. It's sometimes labeling something helps to solve it, but a lot of these quote unquote mental illnesses, they're not the correct representation of what's actually going on with the person. As a result, if you don't define the problem clearly, you can't solve it. You're going to be, spinning wheels forever, wasting energy, wasting time, never getting anywhere. So, and then there's the comments are very interesting. People sharing what, how they experience these things. So just by the amount of comments and what they say, you can see how many people experience gaslighting and all the ways that they experience gaslighting in. We did not need this show to tell us that, because we've been through it. But
right,
but people, this is what they watch. They need it. But it's like, yeah, okay, so they're talking about it. Has it been solved? No.
right. And the thing is that they're talking about it, but it's kind of like a doctor treats a patient, right? So maybe he blew this female off, baby blue, it happens all the time with women, because it's always in your head, or it's just hormonal, or you need to calm down, you're just, women are a little crazy, right? We hear that all the time. But so a doctor's cure, once they get to that, what their thing is to slice, dice, or medicate. There's no rebuilding of that body so that things don't progress worse, or things don't come back, or it's crazy. We have children today. 5 out of 6 kids are like being diagnosed with learning disabilities. They're being diagnosed with neurological issues. 80 something percent of teenagers are in the pre-diabetic category.
Same.
Like it's insane what we're dealing with. Our healthcare system's not working. Our doctors are not working. They're not working to create health. They're working to band-aid, or to medicate, or to slice and dice or pill the manifestation. Once you get sick, right? Once the blood pressure raises, I got a pill for that, right? Well, I can hit your toe with a hammer and raise your blood pressure really quick. And medication might bring it down for the moment, but if I keep hitting you, eventually other things are going to break, right? So they're not simply saying, let's get back to health. Let's find homeostasis. Let's find balance. Let's take you off. The woman was a Hispanic woman that clearly was overweight, but she clearly had something going on. And so that whole doctor knows best mentality didn't look into any of that. And I think that's where a naturopath or a natural health practitioner, that's where a shamanic practitioner, a spiritual leader, that's where those areas of life, people dig a little deeper, right? Find out, why are you feeling this way? Why are you run down? What's happened? Have you had a shot recently? What medications are you on? Have you had any trauma? Right? And so we want to dig through some of that. And I don't know. I guess I'm just really excited about a new day and a new era for healthcare, because that's not fair what happened to that woman. A good doctor would have seen that not only is she overweight, but she's seriously inflamed. She was losing her hair. She had other symptoms going on with herself. Pain is a really good telltale sign that something's not right.
They talk about this also in a way that they do something that I really don't like, but that's kind of the system. The whole system does it. They're like, oh, it was a racist thing. It's because I'm Hispanic.
Oh, correct.
No, it's not. It has. I don't think it's anything to do with that. They genuinely are gaslighting everybody. It's not just
right.
Hispanic. Maybe they gaslight different people in different ways, but it's not like they treat white people better. I think that's a misunderstanding, or any particular race better than another. They're equal opportunity abusers.
Right. More about it would be like, I guess you could see in race if it's connected to culture and lifestyle and diet, right? Or if you were a female of any nationality and you were a health food junkie and you worked out every day and you really made sure that your food, your environment was very clean. You know, you're gonna address that person's cancer if it happens very differently than you're gonna address somebody who works a sedentary life, works at a job, you know, high stress job, sedentary lifestyle, eats McDonald's every day on their way to the office. You know, I mean, you're gonna treat those two people very differently, not in your delivery, but in what you prescribe, right? What is the goal? So for the person that has a really bad lifestyle, there's some quick changes that we can make that person could possibly recover much quicker than that really healthy person because they're already doing things right? So obviously the cancer that came or hit them or whatever, could it be an emotion or trauma? It sure could be. Cancers can be caused from so many crazy things, right? In my practice, I'm going to treat them very differently. The person that's on a health food diet and that's already really clean in their environment, I don't have to worry about any of that, right? The person that doesn't have that, you know, then now all of a sudden now we have to, you know, help them. We have to help them attain that lifestyle and then figure out what's going on.
Yeah, that's I think the biggest thing that's a holistic concept that's really missing in the conventional system. What I learned very early on when I was doing all of my studying as to what is really at the root cause, like truly at the root cause for why people get disease, and it's either trauma or toxicity or both.
Mm-hmm.
And so, what is trauma? Usually, trauma is something went missing. I had a wholeness. I had an innocence. I had a path. I had a whatever, and then something came in and threw me off, and now I don't have that wholeness, that safety, that something. So something like a hole in me was created, void in me was created, and then toxicity is something bad came in that I don't want, and I can't get it out. So something was taken from me that I can't get back, or something was put into me that I don't want. And one of those, or both of those together, usually it's both together, that are at the root of disease forming. Like around that energy, disease starts to form. And it can take on the form of cancer, it can take on the form of Alzheimer's or diabetes or whatever. And all that very important psychological and energetic component never looked at by conventional system. They only look at that symptom. This is why working with us is so fundamentally different than going to a system that tells you just press this button, take this pill, or do the surgery, cut this out, and you'll be okay, which is never the case. But people only find that out afterwards. When people work with people like us, we help them to win the psychological battle. Get back what they believe they lost and remove what they believe was put in that shouldn't be there. Like some kind of negative attachment was created. And that's where all the spiritual masters talk about. You got to release these negative spiritual attachment because those are at the root of your mental dis-ease, your lack of peace, your lack of centeredness, lack of self-mastery is all these negative attachments. You know, all the traditions talk about that. I deal with that all the time, you know, in my training, helping people release the negative attachments. It's significantly more important than medications.
Correct.
You're not even supposed to be taking medications for that long. It's supposed to be temporary. While releasing
correct.
Yeah, while releasing negative attachment, it's supposed to be a lifestyle. You're supposed to be cleaning out your cup all the time.
Right.
Supposed to be accumulating garbage. You're supposed to be taking the trash out daily. You know, the negative thoughts, the negative emotions. Another important thing is, this is just crazy. So I have heard this idea that a lot of the medical trials and studies are done on men. And if you go to PubMed and you look at a lot of articles there, they say, well, this study was only done on men of this age. This study was not done on women. Well, but why? The
Right.
question is why. But okay, so let's say that's true. And yet, check this out. I went in and I recently typed in all the ways men get lied about men's health. But look at this. The lack of, let's see, where is it? Men's health research is often focused on women's health, leaving men without information and guidance. It's like, wait a minute. So are the trials based on men or women? So, but men often believe that they're not, that like therapy, like talk therapy, or a lot of these different types of psychological therapies are designed for how women operate, not how men operate. So this is where there's a massive disconnect. So it's like, wait a minute. So, okay, so trials are done on men and then implemented on women? How does that make sense?
Right.
What do you think? Why is it so crazy?
I don't know. I don't know.
Because that makes no sense. But a lot of men say that, yeah, they do feel like that a lot of the systems are designed to service women, not men. But yet you look at the trials and they're done on men. It literally makes no sense unless, this is me extrapolating, unless the agenda is to turn men into women and women into men.
Right.
Which we're seeing.
We are seeing
literally seeing that. And as so they're not giving women the proper treatment. They're not giving the men the proper treatment. And that's gaslighting too.
Mm-hmm.
By, so, and people might say, well, why would that be going on? That's just crazy. Well, talk about MK Ultra. MK Ultra for the masses. People, that's a big rabbit hole, and I'm going to bring it up because people really underestimate the levels of MK Ultra, of mass mind control. It has to do with the matrix, and it has to do with people being compliant, people living in terror and in fear so that they would be easily gullible and misled and basically guided into anything, to do anything whatsoever that our authority tells them to do. I'm also under the impression that sometimes some things that are done on the public, men and women, are a trial run for something else. Let's see how they handle such and such. And when they see the result, they disperse it to a bigger population. Like the Tuskegee experiment, that's a very famous one. They were experimenting on certain Black people. When they saw like how that works, I think that they then, sent out those kinds of, not so much testing anymore because they got the information they wanted, but subversion into a bigger population. Yeah, you know what I mean?
I do, because there's a book out. I told you Dr. Naomi Wolf, she's promoting the book. It's called the Pfizer documents. It's all about the documents that they wanted to, all the trials and documents that they wanted to hide for 75 years from the public. And it's really interesting because the biggest chunk of that book deals with the reproductive system in women. The shots were created to create infertility. That's not the first time they've done that. They did that with the DTaP or Tdap, actually, I think, no, DTaP vaccine in Africa. They went into the remote areas of Africa and they were giving all of these kids these DTaP vaccines, and the basis of the vaccine was infertility. And so while it was protecting, supposedly they saw an increase of protection, or what they assumed was an increased protection against diphtheria, the mortality rate was 10 times higher for other things. So it was creating this horrible situation for these Africans. And actually, the African government called people out on it. But we do this stuff all the time, like the Tuskegee experiment and the COVID vaccine. Like, come on, like it's targeting and inhibiting and causing issues with reproduction. So I guess that's, just confirming what you're saying is there's always a trial run for something else coming.
That's right.
So one of the things of letting all the immigrants in, the open border and allowing all these unvetted people to come into our country was because we need to increase our population. Our birth rate's going down. We need to increase our population. Well, if that's the case, then why is Pfizer and Moderna and all these vaccine makers inhibiting the reproduction rate of Americans, right?
And making it very hard for families to survive.
Correct.
The laws in place discourage family building,
Mhm.
discourage child creation. I think it was Warren. I remember reading her book many years ago, and she was an expert in bankruptcy. And she researched why do people go bankrupt? Good question, actually, because bankruptcy is very devastating. And she concluded that it wasn't just one thing that they did. It was usually like a step-by-step process, but she found that bankruptcy was always had one thing in common in all the cases: kids. People would have kids, and that led them to become bankrupt.
Hmm.
I am not sure that she was saying that people should not have kids, but if you were to read that book and you didn't know anything, you're like, well, maybe I shouldn't have kids then because I don't want to go bankrupt. And
Oh,
that's what a lot of people would then conclude. Well,
Mhm.
I'm not gonna have kids. I'm
Right.
just gonna worry about myself. Well, and it creates a very selfish population. And what do we have?
A very selfish population.
Yes. Women, women and men, but a lot of Western women don't want to have kids because it's too they say it's because they want to take care of themselves. But actually it's because it's very hard. It's hard to have a career and kids with no family backup. And society is so broken, there's no family backup. It's very, and families aren't how they used to be.
Right.
And a lot of even in families, people are so selfish that they don't really back each other up that well. They drag each other down instead. So it's tough. But I don't. She didn't say in the book that people shouldn't have kids. I don't think they would ever come out and say that. But I kind of got the sense that, well, because she didn't offer a solution. Okay, well, so then what do you do? How do you have kids and not become bankrupt? No,
Right.
that's not offered. So then inevitably people would conclude that let's not have kids. And that was the message of a lot of the left for a long time. That's why the infinite free abortion and this mass vaccination is to eliminate kids, actually. Eliminate babies. Yeah, we got problems. In our society, we're having a massive problem. Well, so this was a very useful conversation, and I really hope our audience got something out of it. So if these things are true, well, what do we do, or how do we solve these problems? And I think that solutions are a lot easier when you don't have psychopaths in charge. You have to get rid of psychopaths in charge, and solutions will suddenly miraculously appear because, in fact, they were always there. The solutions have been given. How many holistic therapies have already existed for so long? How many people like you and me have been trying to scream from the rooftops of all the tools we have and abilities we have, but nobody's listening because they're too busy, running after their vaccine, standing in line for their vaccine, or
Right.
or in line for eating their hamburgers at McDonald's. But the solutions have been around for a long time. Some since the 40s, since the 50s. And the censorship, that's a whole other thing. The censorship online, how hard it is to get the word out about all this stuff.
Right. And what you're allowed to say as a practitioner.
Yes, exactly.
So that's huge.
So maybe that's going to be a whole other show in itself, all the censorship and all the things we're not supposed to talk about. Well, we're going to talk about them. And maybe we're going to get censored. Hopefully not. Maybe we can have a way of talking about it where we don't get censored. But people need to know, like sometimes people really don't know why we don't talk about certain things.
Right.
As a result, people are led to believe that those things don't exist, or that they don't matter. But that's not the case. So there's some way we can talk about it. Like anything to do with cancer, online gets suppressed. Even that word, I tried to post hashtag cancer on social media, Instagram, can't post that post. So the platform does not allow that post to go through. Or it allows me to post the picture, but not the words.
Right. I think censorship is going to change drastically. So fingers crossed, fingers crossed that's going to change.
I hope so. Well, that's the Constitution, right? And Trump is pro-Constitution, freedom of speech. Let's continue to pray and see what happens. And So in the next show, do you want to continue talking about how women are gaslit? Or do you have other things you want to talk about? Or do you want to talk about how men are gaslit?
I think maybe we'll go into men. We could.
Yeah, let's do that because I think men are also gaslit a little bit differently, and men
Mhm.
react to all this stuff differently, and I think that's a very useful thing to talk about because men typically they don't buy into the bullshit as much. Like the whole Today video that we just watched, or one of the reporters, she said, "Well, women are afraid to make the doctor angry." Most men don't give a shit if the doctor is angry. If they think the
Right.
doctor's lying, they're like, "I'm not doing what you want me to do. F you." And it's like, well, women should have that attitude. Why don't more women have it? If more women took that stance, like you're like, I can tell you're lying to me, and I'm not gonna do what you want me to do, there would be a lot less problems. But women acquiesce. Why do women do that? Don't acquiesce. Don't.
Right. Don't want to rock the boat.
Yeah. Like why do you don't need to be like that. But why do women believe they have to be like that? You know, please the doctor. When is it since when is it your job to please the doctor?
Right.
You know, that you're paying him essentially or her. They're supposed to serve you. They're not your king. You're not their servant. It's very strange. And yeah, it's very strange how people worship doctors. It's a very strange religion. But anyway, men don't worship doctors, thank God.
Right.
And so there's a very different relationship that men have with the medical system. They are gaslit. And I did a video maybe a year ago or 6 months ago on how Gordon Ryan, who is the GOAT, the greatest of all time in Brazilian Jiu-Jitsu, is considered that, how he was medically abused by the system. I don't think he even realized he was abused. Men either walk away and don't get any treatment, and maybe they get worse actually, or maybe they don't, maybe not much bad happens to them, or they end up being like Gordon Ryan, abused by the system, and what that looks like. And in my own practice, because I have worked with quite a few men who were abused by the medical system. It's a whole story. So we'll get into that next time. What is your website? How can people find you?
My website is elevated-wellness.com. And that's the best way to look for me. My contact information is there. My clinic address is there, as well as my phone number. And or you can find me on Facebook as well.
That's right. And we work together. So if somebody wants more of a coaching program, they should reach out to me, and they're going to get a lot of your services in the program. But if they just wanted the naturopathic services, they could go to you.
Thank you.
Have a beautiful night. I'll see you next week. Bye.
Bye.